Hello, my name is Michael Savoldi. I was a resident farrier at the W.K. Kellogg Arabian Horse Center, which is located on the Cal Poly campus for 30 years. I also taught farrier science at the California State Polytechnic University in Pomona, California. Two great positions, and like I said before, I loved what I did. My work has always been my hobby. So before I start this discussion, I would like to mention a few things, mistakes that I have made on these lectures. My mind works faster than I speak, and so I'm usually 5 slides ahead of what I'm talking about, and I don't always hear everything I'm saying. So I've made some faux pas. A faux pas is simply a mistake, and for those of you who know and understand anatomy, I hope you realize that. And for those that like to challenge or look up things that I may misquoted, please do so, because that would be a good learning experience for you. So I would like to talk today about 2 common pathologies that can be found in the hind foot. I've worked on a lot of horses before, and I've studied a lot of thoroughbreds. And these 2 pathologies are extremely common in the hind foot of a thoroughbred horse, but in a lot of hind feet. You see, as soon as the horse is born and it stands on its foot, the bone starts loading onto the top of the sole, body weight, and so problems start developing on day 1. As time progresses and as we learn more about the structures, the internal structures of the foot, we will start dealing with some of these issues. So I'm just hoping to bring this to your attention and for you to start looking at them and thinking about them. We'll start with, again, one of my many favorite sayings, and that is pathology never lies. So the 2 common pathologies of the hind foot would be collapsing of the sole arch in the midsection, and primarily that's caused because gravity always wins. The second is the heel arch yielding to the load. And this particular developing pathology is based on conformation. So once you begin to recognize these 2 areas, then you will really see how important it is that we concentrate heavy on the hind feet. We must protect the hind feet because that's what keeps the front feet going. So there's ways of dealing with these issues. So let's start off with one of my favorite sayings is, what do you see? Now in your upper left-hand corner is this same foot that has not been trimmed. The main picture in the center of the screen is the foot that has been trimmed to the sole plane. Now I talk a lot about the sole plane because that is a trimming technique based on anatomy, and it's an excellent technique for me to use for research, because it gives me the exact measurements of the foot, eliminating length of wall. And so I know how the foot is standing, or how the horse is standing on his foot. And that's an issue we really need to address, is how is the horse standing on his foot? It's critical. It's critical to humans and to other animals. So let's start. Of course, we're going to be using a right hind foot. So I will point out a few things, and then we will cover them in this lecture. White line is a very important portion of the foot. We do not want to see the white line shearing or tearing. That means that there's stress taking place, flexation of the hoof wall, a lot of times how a horse is trimmed, things. There's many factors, how the foot is loading internally. You see, when the bone pushes on the top of the sole, it will pull the white line away from the wall. That's really what we see a lot in laminitic horses, is the white line is being pulled away from the wall towards the body, and then it has to deal with everything else that's involved. The next thing we can notice is dark yellow tissue in the white line area. This is something we do not want to see. It's stress, internal stress, and we will touch on this topic shortly. Here's a separation of the tissue in the white line. Well, if you look to the left side of this foot, in the quarter area, in this area right through here, you can see that the white line is separating. It's breaking apart. Well, what's causing that? Body weight. The bone is pushing into the top of the sole. It's pulling the white line away from the wall. Now, if we go back to the lateral side, this is a severe case of damage taking place through load, weight-bearing portions of the PIII bone and the ungual cartilages. The next thing is important to notice or recognize is the white line is below the sole plane. So let's come back here to our toe area, and we can see that the sole plane is even with the white line, and the wall's been trimmed to the white line, to all of these planes. But in this lateral side of the foot, it's deep. The white line is inward. So the white line is attached to the hoof wall. It can't move up and down. So what is moving? The sole. Body weight is pushing on the sole, and the sole is prolapsing and pulling it further down, lower than or away from the white line, in actually two directions. And then we have the sole rounding, rounding in that area. So when you see this on the next horse or on when you go to shoe horses, again, start looking closely at this. And I'm hoping this talk will help improve your knowledge of what's happening internally. And then, of course, flattening of the sole in the midsection. Now, I do have a little discussion on that in another series of these little talks that we're doing. So we can start with a little outside description of what we're looking at. This is that foot. It's a frontal view, and it's a right hind, and we can see the shape of this foot. It's a little bit opposite of what maybe you're used to seeing on horses, because generally the lateral wall will have more of a bend, outward bend, and the medial wall will be straighter. But on this foot, because of how the foot lands on the soil and the ground forces, is forcing that wall to migrate towards the body. This can cause severe damage to the ungual cartilages and the PIII bone. But on the medial side is picking up this bend that's bending outward. Now we can look at the bone. It's been said that the hoof capsule is the shape of the bone. Well, let's take a look at this PIII bone. It's not the same shape as the hoof capsule. The hoof capsule is straight on the lateral side and has a bend on the medial side. The PIII bone has more of an angle to the lateral side and straighter on the medial side. So this simply demonstrates how the wall can be distorted around the bone. That's what we're looking at. So it can be a misnomer to say that we should shoe a horse according to the shape of the bone, because the capsule is very movable, distortable, and the bones are solid. If it changes, it's generally due through demineralization of bone, pilostitis and osteoporosis and those things. Now we can look at the lateral view of the same foot, and there's some very interesting things here I want you to pay attention to. And that is this area of the foot coming right through here. You notice how the tissue is shiny, and it also looks like it's rolling under a little bit. So we'll discuss this area in a few minutes, but it's a critical thing to note when you're observing the horse from the outside, looking at the outside. In this talk, most of my talks, I like to take you from the outside in so we can understand what it is we're looking at. But if we look at the PIII bone, we can see pathology developing in the same area as what we see on this hoof wall. We see all this shiny tissue, and we can see pathology starting to develop into bone. This is not a full bone. This is not how this horse was born. And ungual cartilage is also involved in this area also. So I use the terms horizontal and vertical plane. Well, a horizontal plane is the plane tangent with the Earth's surface as an observer's eye. So in other words, when you look at the floor, you're seeing a horizontally plane floor. At least I hope you are, unless you're standing in the mystery house there in San Jose. You would be seeing a horizontally plane floor when you look at the floor. then we talk about a vertical plane. And a vertical plane is simply perpendicular to the plane of the horizon. Now you will hear me use the term vertical depth, and this is what I'm referring to, is the vertical depth of whatever we're talking about, like the hoof wall. The vertical depth of the hoof wall means I'm talking about the hairline to the bottom of the foot. Okay, we'll stay with our right hind foot. In the upper left-hand corner, we can see the foot before trim, and now we can look at a foot that's been trimmed to the sole plane. Now, all my research is based on the sole plane because that trim is based on the true foot of the horse. And so when I do my measurements, it gives me accuracy. If I left length of wall on this foot, I would have false measurements. So in other words, if I were to measure the vertical depth of the wall on this foot, I would be getting what the foot is telling me at this moment in time. So that's why I prefer to use trimming to uniform sole thickness for my trimming technique or trimming to the sole plane. So what I'd like to do is note some of the improvements that have taken place. But I'm going to take away the distal border of the hoof wall, distal being furthest away from the body. And we can see that the vertical depth of the sole border verifies the plane of the hoof capsule. So this tells me that how the horse is standing on its foot. It is critical to a horse how it stands on its foot. If the wall length was different, then any wall length that is beyond the sole plane will alter if it's not equal, then it will alter the plane of the hoof capsule, could cause stress to internal structures of the foot because nothing's in alignment very well. The word balance is a hard word for me to use. We'll see in this foot that what are we going to call balance? We could say that since this foot's been trimmed to a horizontal plane, we could say it's balanced. But when we look inside the foot, these other things will not be on a horizontal plane. So we're only using the word balanced for one item. So it's a very difficult word to use. So I refrain from using that word. Now I'm going to... Okay, now what we've done is we've removed the hoof wall, and we can see inside some of this the tissue that lies within the hoof wall. There's a few things I'd like to mention on this foot before we proceed, and that is the hairline. One side is lower than the other. Another thing that we notice is the vertical depth of the sensitive lamina. They're not equal. So a lot of times we want to use the word balance. Well, if we wanted to do a symmetrical balance on this foot, we would have to lengthen the wall, leave some wall under this heel, under this side of the foot in order to raise the hairline so it would be symmetrical or on a horizontal plane. That's going to alter how the horse stands on his foot. And so that's never a good thing to alter. Once you establish tissue, when a horse is trimmed, the tissue has to adapt to that trim. And after a few trimmings, then the tissue is all adapted and has settled in. And if you change farriers, then most likely you're going to send new tissue. So we have to be careful about ever changing the plane of the horse's foot from one particular trim to another. So I will take you now, we want to see if the PIII bone and how that looks. So by removing all the soft tissue, we can see that the PIII bone appears to be on a horizontal plane. Well, we've established that the hoof capsule is on a horizontal plane by using a uniform sole thickness, by looking at the vertical depth of the sole plane, or of the edge of the sole. But on this foot, the one with the soft tissue removed, we can look at the plane of the PIII bone. And although it appears to be on the same plane as the sole, there is a little discrepancy there. If we look at the corium, it's thicker on that side than it is on this side here. So that means that this bone is tilting a little bit or listing a little bit to the lateral side. I like to refer to it as a roll. It's rolling to the lateral side. So that will compress the dermis in this area. That has an effect on blood circulation and blood flow. So it's difficult to maintain a horizontally planed hoof capsule just through regular horseshoeing. We have to advance into more modern use of materials to maintain the plane of the PIII bone. But what's happening is it's pressing down into this area that's causing this to collapse, the dermis to collapse. And this actually, if this falls even further, this side can even open up, can have more of a space into our dermis, or the corium. Corium and dermis are basically the same. And this is the reason. You can see that the arch of the sole is showing signs of collapse in the heel area. Well, when the bar collapsed, the bars, these are the bars, as you can see that the bars on this foot are fairly well collapsed. But as they collapse, if this one should collapse, this one's lower than this one, so the bone is going to be in a lateral roll, like we saw in the previous picture. And it's compressing the dermis. So I'm kind of getting carried away. Another thing that you see on this picture is that that sole is not it's not a level sole plane. It is bending upward. That upward bend can put little wrinkly lines on your hoof capsule in the heel area. If those lines are getting heavier, like you're closing an accordion, then most likely you're going to have more of a severe compressive load in here and a stronger bend here, because this wall will be bending upward even more so. It's bending towards the hairline or towards the body. It's pushing down here and bending up here. Placing the bone on this foot, we can kind of see the areas that we're discussing. Is that the bone is lowering on that side more than the other side. Remember, where it's compressing the dermis, it's causing other damage, but it's also causing the hoof to bend upward, the sole plane to have a little upward bend. Now we can look at this on the lateral view of a horse's foot. Lateral is simply furthest away from the body. So we're looking at the outside. If you're looking at the horse, this would be the lateral view because it's further away from the body. Again, we wanted to talk a little bit about this tissue, this shiny looking tissue here. Maybe it's telling us something. If we go to our other foot over here, we can see that it's been trimmed to the sole plane. The sole is very uniform in its vertical depth, and so we have a horizontally planed hoof capsule. Here we have removed the hoof wall, and this is where it gets a little interesting because we want to know what's happening inside. What are these little outside exterior clues telling us? And we can see some very interesting things here. Is this PIII bone is remodeling in the sole area of stress. If you notice that it's lifting up here, there's two forms of this being higher than uniform in its depth. One is this roll that you see taking place here is causing this wall to bend inward a little bit. That could create a pinching problem, and it also can create stress to the distal border of the sensitive lamina and to the dermis. Well, that's the other cause for the wall for this white line to increase in its vertical depth. When the sensitive lamina is under stress, it will keratinize. It will get stronger. Well, if this portion of the distal furthest away from the body, if this portion is under stress and is keratinizing, what's happening to the vertical depth of the sensitive lamina? It's decreasing. What will that do to the bone? It will pedalostitis. So now your bone is going to get less vertical depth as time passes. So it's a chain of events, and we have to recognize these and learn how to prevent them or try to stabilize the foot well enough to where this horse can get more use out of its life. Another thing we want to look at here is the dark yellow color. That's a sign when the white line has been removed. There's there's detail that you can know when you've got the white line off of the sole off of the edge of the sole. I left a little bit of the white line through this area because I wanted to demonstrate yellow white line. You saw it when we looked at the bottom of the foot, you saw that, the yellow white line. I've just removed that yellow tissue up to this point. I left this point because I wanted to show the different colors or the different areas of stress that can take place. And then this is the distance of the roll, how much foot is being actually compromised by the bone pushing into the body. And we can also see now that the white line is deeper or not on the same plane as the sole plane. It's deeper into the foot. You know, I really can't say it's deeper in the foot. There was a faux pas, a mistake, because the white line doesn't move up and down. It's the tissue around it that moves up and down. So what I meant by deeper, I should have just said the sole in this area is prolapsing further out, away from the bone, away from the white line. I shouldn't laugh. It's tough to kind of get all this verbiage right going. But here's the results of, and then think fast too. But here's the results. This is P-elastitis. Bone is demineralizing. Pathology based on the plane of the PIII bone or the PIII bone. So we can we'll stay with our same foot. Here we see our sole body. Now, soles have different depth, different arches. This particular sole has a deep toe arch, but it also has a collapsed heel arch. So as body weight pushes on the stands on the top of the sole, the arch can collapse, and that's what's happening. This will produce a negative plane PIII bone. Here's an example. You can see that the bone is the distal border of the PIII bone is above the proximal border of the white line. And we have a space here, so that means our dermis is not compressed. But now the bone is actually a little higher than this because remember there is a dermis here. This is here just for demonstration. But as this bone gets lower, as the tissue starts to get below the proximal border of the white line, in other words, very poor bone elevation. One of the best ways to keep a foot healthy and strong is in bone elevation. Remember, you can have too much elevation. That would be more of your upright, your straight heel, your straight wall angles. And then you're going to see other problems like more side bone and feet like that and other issues. Or you can have too low of an elevation, and that's kind of what we're looking at here. And then a collapsed heel arch. Now I'm going to use a negative plane PIII bone for an example. The student that did this foot, I'm sure will recognize it because, well, I won't really talk about it, but I'm sure he'll recognize it when he sees it. So an example of a negative plane PIII bone, it'll have a deep toe arch with a collapsed heel arch. And here's a good example of how the bone moves. See, the bone can lift even further off of the toe, creating, if this is going down here, the bone can actually pull further up off of the toe. You know, I have to sit up here a little bit, falling off my chair. But the bone's always moving. When the fetlock falls, the rear half of the bone can push down, especially in this combination. The rear half of the bone will push down, but the toe lifts up. So you have to be careful on a lot of these movements and exercise. If the foot's not set up right, just exercise alone can damage these feet. And by exercise, I mean training or riding or whatever. So it's important to recognize that the bone always moves. Now, if we look at the upper portion of this page, you can see here's a very young foot with a top line to an arch that's horizontally planed. They're very close. Over on the right side of your slide, it says good bone elevation. But look at that bone. This should be one of our goals, to maintain a bone that has good elevation. Look at the space for our circulation for blood, for our dermis. All of these are positives. A horizontally plane of capsule, a horizontally plane top line on the arch, which is rare to find because we're not concentrating on how to maintain or manage an arch, and then a horizontally plane PIII bone. When you see this combination, when you see a really nice looking foot that you don't have to worry about, pay close attention to it. It won't be exactly like this, but the patterns would be very close to this. So now we can look at the bone position on the sole. So here we can see a stress in the midsection, and we can also see stress in the heel area. Remember, this is a hind foot. So both of these areas have sensitive tissue and they have nerve endings. So we have to be careful because the horse could show some signs of lameness. And this is the damage that we can see on the top of the sole. Quite a bit of damage taking place, and that's all because of weight bearing. This sole is bearing weight on a negative plane PIII bone. This right here is a good explanation for corns in this area, corns and abscesses in this area, because the tissue is being compromised. And then this is the stress to the PIII bone, or the pathology found. Now, these areas that you see here are extremely rough. They could cut up your glove if you're wearing a glove for dissecting and you run your finger over that, that's possible to just cut that. And imagine these sharp points are all working into these areas here, into this area primarily. This is a little side bone over here. This at one time was cartilage. And its cartilage is hardening, so it's working back into this area. Pathology in the midsection. I just did a little talk on this, but a review is always good. So this area of stress and damage is very common and often not recognized or treated properly. So this is what can happen. We can see crush to the bar and to the sensitive lamina. We can see damage to the top of the sole there. That's all non-sensitive lamina is what we see crushing here. The sensitive lamina has been, this is all non-sensitive lamina. A little mistake, but we corrected it in time. I don't have to review these films and think, oh no, what did I do this time? Which I do often. And then here's our sensitive tissue. So it's all affected. Everything's happening here. This area might test out to the veterinarian as the veterinarian may misread this and refer to it as navicular disease or navicular syndrome or whatever other things. But I've seen a lot of these feet in my life. I've dissected several. Well, I don't want to get into numbers, but this is quite common in feet, but it's also in the area where the navicular bone would be above it. And I've seen, this is very common, but I don't see that much stress compared to this amount of stress on a percentage basis. This isn't even close to being able to say it's navicular disease. So stress in the midsection, we can see the upper right left-hand corner where the arrow is pointing to the stress, and then our main demonstration. And you can see here, so this bone has a semilunar ridge. I think the other day I called it a semilunar crest or something, but it's verbiage. Excuse me. And this area can crush a lot of the side area that we see coming down through here, and here. Now, the further back it gets, the crush can begin due to at the mid-stance phase, the navicular bone is pushing all of that tissue down into there, and the navicular bone's a solid object, so it's not going to move very be forgiving for the load. So it pushes that tissue down and it bottoms out in that area. And here's an example of shifting of tissue in that area to just another sign that the bars are loaded and they're being weight bearing. You can see tissue shifting around in that area. And if we were to just cut the sole in half, here's our flattening. These are the effects of load. The bars are flattening off up here. It's disturbing all of this tissue. It's shifting it all around, causing disturbance and stress. And here you can see some wear or some damage to the lamella of the foot in this area here. So these are just showing different signs showing that this foot is collapsing in the midsection. This isn't strong enough to hold the weight. Also, you don't want to see this curve. This is a negative for feet. We have a little bit on both sides, but this is the main side that we're talking about. And you can see how far this has dropped down below this area here, below the proximal border of your white line. All of this is dropping down. So this is collapsing in the heel area of the midsection. And this, again, is the damage of the foot that we're talking about. You can definitely see the two areas of stress. The corium and the sensitive lamella is all being crushed out and worked out on this side, on this here, and then if we were to flip this foot over and place it, it would be all right in here. And you can also see stress developing here too, shifting of all this tissue coming down and into here. So that's really why it's hard to look at a foot like this and say, well, the bar ends here. No, it takes a lot more detail to be able to tell people where the bar ends. Collapsed heel arch, or sometimes referred to as a drop sole. I put this in here because we use the term drop sole a lot. To me, it's more of a sole that's prolapsing. So here we have our white line. Remember that that's an important issue that we need to learn how to manage. There's a lot of things we have to manage in this foot. We need to manage the angle of the bars. We need to manage the white line, yada, yada, yada. But if you look over on this side, you can see now that the white line is below the sole plane. If we look at a different view, we can see that the sole is dropping down, or referred to as a drop sole, but really the sole is rounding around bone. That's what we're looking at, and that's a negative. Here's our area of stress. This is the length of our area of stress that's taking place. And this is defining a little bit of the different colors you might find. Remember that where the sensitive lamina ends, the sole begins. So here's where our sensitive lamina ends. This is where our sole is beginning. And we're picking up we're getting the dark yellow color, which is not what we want to see. You'd like to see more of a lighter tissue color to your white line than the dark yellow. Well, the next stage is possibly red, and the stage after that could just be black. These shift around. Again, there's no absolutes to a lot of things we talk about in the foot. Here's a good example of the sole body is rounding and moving upward. This is another visual of where you can see how the area is being forced to drop down or to prolapse out. And the PIII bone is pressing into the sole, shifting around, the sole shifting around the PIII bone. And then I'll show you in this area the damage it can do to the dermis. You see, as this is all under stress in this area. It can be swollen. You can see this sometimes it'll be very swollen compared to other areas of the dermis, and it can be inflamed. And when tissue is inflamed, if the bone develops inflammation, then we've just advanced into pilostitis and demineralization of bone. And this is the bone that was in that foot, and you can see there is a little pilostitis taking place in the toe because that's not a full toe, it's not level. But here's the rough areas that we spoke about. This is the pathology, bone demineralization, and it's on both sides. But the lateral side has a lot more than the medial side. And then we can look at, here's a group of 3 different bones, figures 1, 2, and 3, showing the same thing. These are examples, but there's just different stages of pathology developing due to a bone pressing into the sole body. Now, one interesting thing about this is that these are all front foot specimens. And the same thing can happen in the hind feet and front feet. So although I'm focusing right now on 2 basic pathologies found in the hind foot, there can be found in front feet also. So let's go back now to do a little homework. 2 common pathologies in the hind feet. We're looking at the bottom of the foot after it's been cleaned and prepared for visual inspection. Again, if this was a horse that was this is a cadaver limb. We use cadaver limbs for research purposes and for educational purposes. And if this foot was trimmed on a live horse, I would be a little leery about having it walk off. I'd probably want to leave more protection there because these feet need more protection. I think Craig Trenka did a little video the other day and on a horse in Arizona, and that was a lot of protection. He gave that foot a lot of protection. A good example of treating horses for trimming a foot and leaving protection. So here, let's do our review. Of course, remember that this tissue can be extremely moist because it was protected with all the length of wall. So that protects the tissue, and so it generally has a lot more moisture in it than the open toe area would have. So unequal content in moisture. But as soon as this dry, if we would trim these horses every 3 weeks, this whole foot would stabilize and change. You can ride horses, or you can show horses barefoot with in dressage and a lot of different disciplines if you put them on a 3-week trimming protocol. But you also want to trim, make sure your heels have been removed on that protocol, or you're going to lose too much toe on a barefoot horse if you don't eliminate the heel. Again, I'm off track, I'm sorry. So here's our little homework assignment now. Picture this as a quiz. So we notice dark yellow tissue in the seat of corn area. We see separation to the tissue in the white line. We have a sole rounding around bone and flattening in the midsection. And then we can look at the top of the sole. Here we have the stress that can be caused. Here we can see prolapsed sole and the damage that can be caused. There's our damage from our sole rounding. Of course, our stress to the damage to the lamella of the bar. And all flat right through the midsection. So these are all naturally occurring items that take place. We have to be aware of them, and we need to learn how to protect the foot. Our traditional horseshoeing does not address these issues, and so we must learn to advance, have an open mind in order to advance into a more modern farrier science. A review again, here's our midsection. So this is our area in the seat of corn area, and like I say, there's a good possibility for abscesses or corns to develop, or abscesses. Abscesses I usually find are more shearing up of tissue. This is more of a compressive load to tissue because you don't see the shearing effect of the white line. You just see compression to the seat of corn. And then in our trauma in our midsection. And also this foot, we didn't talk about the toe a little bit, but it's actually stressed a little bit in the toe area. Remember the mechanics, how the bone can move up and down when it's loaded. Well, just the upward pull pulls on the dermis. Another side note, for those farriers, sometimes we get a little lazy and we use our nippers to clean the excess sole out, and you might catch part of the sole, and when you're pulling on your nipper, the horse jerks. Well, horses are accustomed to feeling compressive loads on their feet. They're not accustomed to feeling tension. So that nipper, whatever area of the sole it caught when you were pulling on it, lifted the sole off the dermis a little bit, and it felt it. Well, a bone can move up and down in the foot. So if it's too much upward movement, like I say, you will develop the tissue. If the tissue doesn't follow the movement, then it's going to shear or tear. If it follows the movement, then you'll get a deeper toe arch. So there's different combinations that take place, and a lot of that has to do with tissue strength and moisture and things like that. So that was a fun little thing to do, and I kept it in a reasonable amount of time. I'm exhausted. Talking this fast is just something I don't like to do, but I enjoy doing these for everyone. I'm primarily doing this for the benefit of the horse. Horses have to deal with a lot of stuff in their life, and if we can just give them a little comfort, we will be doing them a favor. Just remember, everyone, remember this. We may not need horses, but I guarantee you the horse needs us. So I hope you all have a good time. I hope you can enjoy this. I do post these on YouTube. And if you subscribe to YouTube, it's free to subscribe. So that will give you a notice whenever I post a new one. So enjoy your time. I really hope you enjoy this lecture. And I've hoped I can raise the level of your knowledge. Thank you again.